Hi, I'm Michelle McLean, your host for Tip Radio, Top Industry Professionals, where we showcase prestigious professionals from around the world sharing their stories of success and inspiration. Today, we have a wonderful woman who is a world-renowned top oncologist and hematologist, formerly affiliated with Duke University Medical Center and Thomas Jefferson University. This amazing woman is an in-demand physician widely known for a passion in healthcare and is also an author, teacher, and lecturer. She was just recently honored at the International Association of Top Professionals at the annual awards gala at the Bellagio Hotel in Las Vegas for her selection for IAOTP's Presidential Award and the Healthcare Hero Award. Everyone, please welcome Dr. Susan Littman. Hi, Susan.
Nice to meet you. Oh,
Lovely to have you and to interview you. And it was so nice to celebrate you in Las Vegas on the billboard, Planet
yeah.
Hollywood. So, what did it feel like?
Oh, it was terrific. The weather was beautiful. Got away from the winter weather, and it was just so wonderful to see everybody and be with a lot of like really ambitious and talented individuals.
It's wonderful to celebrate you, and obviously for us to celebrate our colleagues, our nominees in and honorees in all the different industries. But you've been dedicated. You've dedicated years of your life to healthcare, hematology, and oncology. So for our listeners and people who haven't got to meet you, just tell us what started you in the industry? What got you interested to be a doctor?
Well, I wasn't initially interested in being a doctor, but I had some life experiences that um, impacted my life quite a bit, and I felt like it was necessary initially for me to learn more about medicine, and then I chose to become a doctor and pursue this career. And I really feel like it was like sometimes there's things that happen to you that are serendipity that you're not expecting, but they lead you down a path that's the right thing for you.
Would you be open to sharing one of those stories with us? Because I'm sure there are many people that would be inspired to be a doctor or an oncologist or hematologist. What could you share one of those stories with us?
Well, what happened is that shortly after I graduated from college, I had two family members that developed cancer, and I I found that like we were as a family completely unable to handle that sadness and that difficulty in knowing what exactly was the right thing to do. So I I I transitioned to this role of in the old days you had to go to the library to
Yeah,
learn information and
I'm part of that era. I put my hand up.
so I would go to the medical library and read up on the problems and learn and then bring them back home. And then I realized that, I really found this medicine to be inspiring and I wanted to do it myself.
It's a very difficult role. I mean, from my background in having a foundation and dealing with children with cancer and building children's wards and not only children, but how do you deal with your patients in because you've had that personal experience? How do you allow them to transition and to really embrace what they're going through? I'm not saying, accept necessarily, but like try and embrace and deal with it.
Mm. What I find is kind of what I learned from my own role as a family member dealing with cancer in my siblings is that the best way is to be honest and to inform people about what they're dealing with. Like it's knowledge and education and a good understanding of where they are that really helps people to internalize and accept what's going on, but also be fighters, in the sense that you can't go through any kind of medical treatment without really knowing what you're dealing with, and also like for a cancer, something that's potentially life threatening, you must also have a fighting spirit to be able to go through the various treatments. But I one thing I did notice, I had noticed through the years of practice, is that not everybody can get their head around all the information all at once. So
Mm.
you have to realize that you have a long-term relationship with patients, and you're seeing them a lot during any kind of treatment. So you have to like put yourself quickly into their shoes, get a sense for where they are, then come back to yourself and say, okay, what is the information that I think that they can accept right now, so you don't overwhelm them and you allow them to have the right knowledge to be able to go forward.
Well,
So it's somewhat of an iterative approach, but it works really well. Like sometimes, and then you don't have to go and try to share different things with a family member or a loved one. Like everybody's all in the same boat dealing with whatever it is.
that was going to be my next question is I'm sure that you spend a lot of your time almost like a psychologist as well, because you've got to be very, very careful how you give the information
Mhm.
at what time. And that was going to be my question is how do you, so you're a lecturer and an author and a teacher. You have to impart this information and your experience, your personal family experience, as well as a, as a professional. What do you say in your lectures basically what do you impart to anybody who wants to be in your profession?
Oh, professionally, I think that it's important for people not to really get their heads around that it's a helping profession, that it's hard work. You're in training for a very, very long time. And it's a kind of a training that's very intensive. So it's not for the person that just can stand on their accolades or not be willing to put a lot of time and effort into the training
Mm,
for other professionals. I think when you're dealing with patients, like I said, you have to use your senses to impart the knowledge in a compassionate way. And
mm,
we tend to we've always been in medicine. You teach to um, in a way that you ask open-ended questions or you share things in open-ended ways. So that allows you to get honest information back that you can guide yourself as to how to go to the next step. You're always kind of constantly listening and hearing where people are. And that's actually probably true with teaching as well, is that you unless you're in a lecture format where you're just imparting information in a rounding situation, you're you're kind of providing information and then looking for feedback to make sure that people understand where you are.
And I'm sure, I mean, I have absolutely no understanding of what you would go through every day being a physician and imparting sometimes the most horrific, life conditions to somebody,
Mhm.
um, whether it is treatable or not. How do you cope personally with every day, somebody's going through a really hard time? How do you not take that on in your own personal life?
You do take on certain tragedies in your own personal life, like you, not in your own personal life, but in your professional life. And you think deeply about certain things when they affect you. Like a person is a really dynamic person, and now they're suffering with this terrible disease. There's something that kind of wells up inside you with a like a sadness for them. But
Mm.
you still need to um, try to help them through these steps from a medical point of view. So I think you interdisperse those feelings, and then you translate your emotional feelings into the helping you, like so that you sense again where they are, what they need, and then guide them through what needs to be done, like what needs to be shared or provided. You know, people, there's no longer, I think many years ago, even before I trained, you know, there was a paternalistic attitude, like not to give people all the information, but that's no longer acceptable in our society. So you really must be completely honest with people, unless they with your patients, unless you know you sense that that's really problematic, and then you maybe are a little bit more sparse in terms of the what you say, but the gist of what you say is the same, if
Yeah.
that makes sense to you.
Yeah.
Like, yeah,
Yeah. It's
you because
finding new ways to communicate that.
yeah.
And in the new era as well, because a lot of people, and I'm really digressing here from a lot of the questions that I'm asking because I'm so interested in this topic, is when people go onto Google and they decide that they've got these symptoms and that, and how do you, because there's so much information out there right now that it's almost like you're talking to a pseudo doctor when they come to you in your office. It's like they seem to know everything. I don't know if that happens to you, but
Oh
you know,
yes, it happens a lot.
and you
And
have to say to them, I'm the doctor. I'll tell you what's happening with you.
so you know, this is a somewhat of a big problem for people in medicine because of the sort of massive amount of information out there that's anecdotal, and people believe what they read, and like you say, they think that they're the doctors. I I sometimes let things go unless it seems to be harming them.
Okay.
And
You let them think they're right until
yeah,
they
and
think.
like there are times in which people like you have to gently correct them, and sometimes you have to be a little bit harsh, just if it seems like they're reading something and they're really going down the rabbit hole in the wrong direction, doing things that are harmful to themselves.
Yeah.
If it's a little thing, you can let it go. But if it's a major thing, you know, then you sort of have to correct, unless it's something that is like it will do no harm to them.
Yeah.
Like you know, like
You just
if
kind of
they
let it
want
go.
to. I had once a patient who read these Eastern philosophy things, and they were rubbing their skin with some medallion. And even though they believed that that was helping them, I knew it was doing nothing. And but yet it became part of their belief system, their positive belief system. And there's a lot of evidence that in medicine, having a positive attitude, no matter what it is, whether it's a Eastern religion or, traditional Judeo-Christian religion of, believing in God, those things help people to survive illness and to survive tragedies. So sometimes you can let things go if it's something like in that realm that will do no harm. But if it's something that, they have hyponatremia or, and they've decided they want some other treatment for it that's causing the condition to be worse, then you have to correct them. And if it gets really profound, you have to really tell them, this is not peer reviewed, this information, there's a lot of anecdotal information, and then you have to go piece by piece through the information to correct their misinformation.
Well,
So,
that's very fascinating. And I'm sure it's a whole world apart for you to be on this glamorous billboard in Planet Hollywood, on the Planet Hollywood billboard in Las Vegas and celebrated with more than life-size billboard of your achievements in life. I mean, you've been on magazines, you've been in TV shows, you've been an author of books, so you're no stranger to the limelight. But what would you say? I mean, if I look at some of your achievements here, um, yeah, I mean, to now be 25 global impact leader book, like so you're an author in that book. I mean,
mm,
that's really impactful and I'm sure that helps in your profession. But what would you say from this experience with IOTP? And they're very dear to me, they're my family. And I've been able to achieve so much through this platform and having the connection with so many other professionals. But what would you say would be your highlight of your career, apart from all the glamour and the glitz and the billboards?
I don't think it's the glamour and the glitz and the billboards. I think it's the highlights are when you really connect and help people, the patients, in kind of almost the little stuff, like either like that you're the one that's able to figure out what's going on with them. Like they've been to multiple different doctors, and no one else has been able to put together what their diagnosis is.
Mm.
Those are the things that really like make you feel like successful when you've reviewed through all of their their data, interviewed them, what we call history and physical, and then thought about it, and then come up with a diagnosis and instituted a treatment. Those are the kinds of things that like they're small, but they really make you feel um, really like you've achieved a lot. Um,
Those are the big wins for you. And
Yeah, I think so. Even though the other stuff is really wonderful as well, but it's in a different way.
yeah.
One thing through the IAOTP, like you meet professionals in all kinds of different, professions, and that's something that is really wonderful because you don't in your normal everyday job you're really with people that are similarly inclined
Hmm.
and or similarly trained, so you become you become a little bit narrow in your thinking,
Well,
Not in
that,
your thinking, not in your
yeah.
interactions, but with IAOTP, it's amazing how many different areas and different professions and talented people there are that you can talk to. And sometimes I go to the meetings and I'm like, wow, that's really amazing. Like, how can I think about what that person is doing and what they're talking about, incorporating it into little things that I do.
Well,
And
that's what I love about IOTP and being the host for Tip Radio because I get to interview intimately many of the honorees and I get to hear the background stories and get to know you guys. So
mm,
and connect you, which, Stephanie and I love to do. So, this is what it's all about. This is our family, and we are so grateful to have you and, be for me to interview you. Now, talking about the festive season, and I know you work hard and you're good at your job, but do you do anything for fun? Do you have any hobbies? Do you take downtime or are you reading oncology books as you're like on
no,
downtime?
I try to I find like Audible is a really good because I have a lot of time driving to places, so I enjoy listening to things that either can help me professionally about areas of medicine that I'm out of touch with, just because I don't do it every day, or just to add like a funny story or fill in some history kind of thing. That's really enjoyable when I'm driving back and forth places. Then in terms of hobbies, I really like gardening and being outside, hiking when I get a chance,
Okay.
um, things
That's
like
pretty
that.
active.
Yeah, I really like being outdoors. And a couple of years ago, I started a friend of mine became a yoga teacher, and I started to do yoga, which is really terrific for your body, your exercise, but also like there's that mind component of it that helps you to relax.
Yes, I
So,
totally agree. One of my favorite. No, that's wonderful. It's been so lovely chatting to you, Susan, and wishing you a blessed, blessed season with you and your family and all the best for your future. And we look forward to celebrating with you soon again.
thank you. Yeah, it's terrific. It's terrific also getting to be one-on-one with you and chatting like this. This is wonderful. Thank you for doing this.
Thank you and have a wonderful 2026.
Thank you. You too.